All right. So, hi, my name is Jeremy Grandstaff. I'm the process architect for the Nebraska Walkable Communities Initiative, and I'm so excited to be here today. We have got a great program for you guys. And for those of you who are live with us now, we're just so excited that you are here and tapping into the opportunities that are ahead. For those of you who may be watching this on video, we're excited that you're here as well. I want to encourage you to take a moment to listen to the dialogue that we're having today. Think about how some of these resources might be helpful to you, and to also think about grant opportunities that many grant opportunities that may be available that you would like to consider applying for. So I'm facilitating today's call, but I am not really the breath of the call. The breath of the call is our outstanding panelists, and we have 3 joining us today with a purpose of giving you the opportunity to hear about new signage guides, other resource guides, other guides that are going to help with social support, with signage, and getting more people walking and active in their workplaces. We also want you to be able to hear from our panelists as they have worked in this space and are continuing to use resources like this and really develop some of these resources and provide direct input, especially into developing them. We also have some mini grants that we'll talk about toward the end of today's call. These are small grants that are available through our 1422 funding and can be used to try to work on some of the social support or signage opportunities that we're going to be talking about today. And most importantly, for you to have your opportunity to ask questions and bring your own ideas. We have kind of a small group on the live session today. And so I'm going to actually encourage you guys to not feel like this is a formal group. I do want Jen and Brian and Jessica to impart their wisdom that they have to you guys. But I also want you to feel like you can participate in dialogue and we can have some discussion that's really going to help you be able to take this work to the next level. A couple ground rules. A lot of times we do get background noise from people who may be in louder areas or might have some echoing happen on your phone. It's always a good idea to mute your line if you are not talking. It saves me from having to mute your line. So if you are not talking right now, it's probably a good idea to just cut that line or hit mute is what I'm saying, so that we're not getting background noise. Another thing that I would say is just be prepared with your questions. Ask us questions. Help us help you figure out how to use these resources in a way that's going to be most effective for you. So I'm getting some feedback from somebody. Does someone have a question so far? Okay, I just thought I'd check. Like I said, I know it's a new system, and so I do encourage you, for those of you who are using the phone or computer, do make sure if you feel the desire to turn on your video, let us see who you are. Let us see how exciting you are. So we have 3 great panelists today that are going to talk with you. First up is Brian Coyle from the Department of Health and Human Services at the state level. Brian is the physical activity coordinator and is going to be getting state physical activity coordinator. Sorry, Brian. And is going to be really unveiling the guides that we have. And so, Brian, I'm going to remind you to share your screen before you get started. That way people are able to see what you're looking at. And then after Brian is going to be Jessica Davis, Panhandle Public Health District. Jessica is the Assistant Director at the Health Department and has actually led 3 different communities through the community-driven strategic planning processes that we do here at the Walkable Communities Initiative. And Jessica was instrumental in providing feedback to a lot of the guides that are created. And so I just really value her being on this call and providing her wisdom. Jennifer Hansen is the health educator for Public Health Solutions, and has also led 3 communities through the strategic planning process to increase walking, biking, and overall health. Jen is actually, my understanding is that her health department is the author of one of the guides, and I'm sure she'll talk about that a little bit more. But again, just a wide array of experience that Brian, Jessica, and Jen have, and I'm just so glad that they're here today to talk with you. Brian, I'm going to actually turn it over to you first, and I'll try to give you a cue via chat or Audible to keep moving along. But why don't we turn it over to you, Brian? Talk to us about why these guides were even important in your realm, why we thought that they would be helpful resources, and really kind of what that overall purpose was, really looking at maybe even your vision for how other leaders in this space are going to be able to tap into those resources.
Fantastic, Jeremy. Thank you so much for the opportunity to really kind of share not only the conversations that we're having at a state level, but local level resources and tools that are actually available. So I want to preface this conversation just with a little bit of background before I dig into the signage and social support guides. What I want to mention is this work is supported by CDC 1422 State Public Health Actions for Prevention and Control of Heart Disease, Stroke, Diabetes, and Obesity. And so I want to focus that we're looking at the bigger picture of opportunities for reducing chronic disease. The signage guide that I'll talk about here shortly and the social support guides are 2 evidence-based strategies that CDC has identified that help to assist with increasing physical activity in communities for individuals within groups, and are strategies that have been key components of our 1422 grant, as Jeremy mentioned earlier, which helps to fund local health departments to really carry out community-driven engagement opportunities, but also evidence-based strategies for their work. So as we looked at signage and social support, I want to mention is there's not a lot of tools that are out there. And if there are tools, the tools are large, talking 30 to 50 pages long, repetitive information, stuff that might not fit Nebraska context. So what I want to highlight here, and the most important piece, is basing the development of these guides on Nebraska experience. So that's why Jen is with us today and Jessica is with us, because they're going to provide, they're on the ground, they're working in their communities, they're putting the signs in, they're developing the social support opportunities to really increase physical activity. So one of the first main pieces was, and why we didn't develop these guides at the beginning of the 1422 process. Now we are in year 4 of a year 4 grant. So we are just finally putting these things together, but it's based on experience. It's lessons learned. It's what are the opportunities, what are the barriers, and based on the information that you'll hear from Jessica today and from Jen, but from other local health departments who've implemented these strategies, we really have a Nebraska product. It's a process, it's a guide, it's an updated information for you to look at these guides and move forward with implementation. Now, I want to challenge you a little bit to think about not only doing signage work or social support work by yourself. It really takes a community, a design team, a group of leaders to come together to really carry this work out. So I'm going to challenge you to think about how can you connect with city government? How can you connect with nonprofits? How can you connect with churches, with libraries, with community centers to really drive home the need for some of this work? So I want you to think about this is not something you should do standalone. So I want to urge you from the outset to think about how can you work with a team of leaders to really carry this work out. So I also want to mention that we have the social support guide that the Center for Disease Control Prevention, CDC, had created. But like I mentioned earlier, there's 40 to 50 pages. So what I'm going to highlight and show you here in a second is how the Nebraska Walkable Communities Steering Committee and the local health departments came together to define the resources and needs necessary to lay out a step-by-step approach for you to build on experience and Nebraska experiences to really carry this work out. So let me first talk to you about the signage guide. Let me open up the signage guide here. So really what I want to talk to you about here on the signage guide is this builds upon walkyourcity.org, which is a great website that's online that you can go to and you can actually purchase signage right now. You can go in, develop the signs you need, placement wherever you need to go, and it's a really quick opportunity for you to purchase signs and they get shipped and delivered to you. But we also, as I mentioned previously, is we build on local experiences. And I want to mention Jessica first, because Jessica really did one of the first signage projects as part of the 1422 grant process in the community of Sydney, and did a trail signage process on one of the new trail connectors that connected town to the south side of town near the Cabela's area. And it was really exciting to see that roll out, and a lot of her experiences and insights are actually captured in this guide itself. So the guide itself really focuses on the why. Why should you do a signage project? It helps people get to key destinations. It helps people identify safe, accessible places to walk and bike and to be healthy. But we also started to develop the how. So how do you get started? So before you start designing your approach, what are the things you need to remember? And throughout this guide, you'll see a couple pictures that are available. This one here is from Central District in Grand Island, used as a wayfinding to highlight their trail system. And I want to mention that they did a fantastic partnership with a community college to help design this in their park and rec to do that work. So following a step-by-step approach can really get you from, okay, where do you begin? What do you need to do for design, and what do you need to think about for design? What do you need to think about for building and implementation? And also highlight what are additional resources you need. One of the main resources that I do want to mention is, as part of the project from the outset, is we created a statewide brand called StepRepeat. So we have a hashtag that says WalkNE. We can do hashtag BikeNE. You can do whatever you need to identify and utilize a hashtag at a local level. But the resources that are available for StepRepeat, you can actually go to the Partners in Health. So it's you'll see this below, partnersinhealth.org. Click on this link and you can go to the resources for StepRepeat. Everything is free to use, and I challenge you to actually use it to meet your local needs and design. This one here is part of Sydney's work, and Jessica can mention a little bit more about that. But the StepRepeat brand is however you want to use it the way you can to get people moving and active into key destinations. And I also want to mention, notice here it says miles. One of the easiest things for people to do is use miles or use time to be active. And that really depends on how your design team wants to decide moving that forward and design and how to make this work. So it's really neat. Here again, we see the signage from Central District. And that's really what the signage guide is about. We're basing the signage guide itself on the local experiences of what we have learned through processes in Nebraska. And I want to say, and Jeremy can correct me, I want to say 2 to 3 different signage projects help to really inform how this guide was put together. So that's really exciting. Now I want to jump to the social support guide. So let me back out of this here real quick and talk to you about the social support guide. Now, we focus this as how do you create a group that emphasizes opportunities to increase walking and increase physical activity. Now, I want to mention to you that social support means so much more than just getting a group of people together and going for a walk or going for a bike ride. Social support really focuses on how do you motivate your community members to be physically active or to be healthy. How do you create a group that can strategize on how to overcome barriers and opportunities? How do you create how a social support group can create opportunities to create dialogue? So let's say we have a great trail system, but we need more because there are certain points in the trail that aren't walkable, or during bad weather, they flood. So how can a social support group help to inform the city on greater needs and greater resources? The other thing that social support does, it connects people to information and to other people. So there's a great education and information opportunity that social support can really bring you to. And that brings me to Jen and what she'll talk about here in just a moment in her community health worker work. So the social support guides here, you'll see that we have 1, 2, 3, 4, 5, 6 different social support guides. So as we took a look at the CDC social support guide itself, which was 40 to 50 pages, we really asked ourselves, what are the key components we need on how to develop local projects around walking and biking and overall health? And what we identified in partnership with health departments and the state steering committee was, let's look at key venues of where individuals where we want to impact most can create these walking groups. So for example, our first one here I'm going to open is the church. So what we have developed in these 6 guides is the why and the how, very similar to the signage guide, on how to create your social support campaign and how you can really roll the work out. But you also got to keep in mind who are the other people that you're trying to impact. And so as we as a state steering committee started to decide what are the key destinations in the communities, churches, I'm going to go back here, churches were one of the first opportunities. Colleges and universities, and Jessica can talk a little bit more about her work in the Panhandle on the college and university approach. Community centers. So how can a community center like a YMCA or a local recreation facility help to create walking clubs at certain times of day? Hospitals and clinics are fantastic opportunities to create walking initiatives. There's a national push for a Walk the Dock campaign that you can actually find online. And Jen will talk to us a little bit more about her community health worker and that connected piece. The two other pieces that I want to talk about for social support are parks and work sites. So these key venues are great opportunities to convene people together with a clear purpose, a clear intention to walk at specific times of day. It doesn't have to be every day. It could be multiple times a day. And these guides themselves give you the step-by-step approach that you need to be really successful in that work. So we took the guide from CDC and broke it down into key areas to really make this work. So that really kind of takes, that's how I wanted to kind of provide you an overview of the guides themselves and why did we want to develop them. But let me tell you what I think we need for you to think about is, one, as I mentioned earlier, how can you work as a group in a community to really build a signage project, wayfinding, as sometimes we call it, or social support campaigns? How do you create the community dialogue to identify that need? How do you engage those key venues like the churches, hospitals, and clinics to get people moving and active? So I want to challenge you to think about how you use the resource in these process guides to bring people around an idea to get people convened to be healthy and active and moving forward. So before you run, think about who those key partners are, such as Park and Rec, such as colleges and universities, such as the planning department, such as schools. What are those places where people can start to be healthy and active, and where do you want people to be able to reach? What are those key destinations in your community that you can identify? And then how do you change either your policies or your environments in community to make sure it's safe and accessible for individuals to be healthy and active, to be through recreation, through commuter opportunities, getting to and from work, or even getting to and from healthy food access. So I want to stop there and turn it over to Jen, who's going to move us into her conversation.
Hello. Okay, so Jeremy, am I just sharing my screen? Is that what I want to do here?
So, Jen, you could do it where you share your screen and you pull up the guides you want to show, or you can ask Brian to pull up specific guides and we can have him continue to screen share because I know he's looking at the guides as well. So either one works.
Okay, Brian, if you just wanted to pull that up, that would be awesome. Thank you so much. So I think if we just go to, there's a kind of a table of content page, I think would be the most helpful. Right here, yep, this page. So really the way that the toolkit is laid out is in 6 sections talking about healthy eating, physical activity, the importance of stress reduction and healthy sleep, lifestyle change, medication adherence, and alcohol and tobacco use. We chose community health workers as sort of the implementer, or as who we thought would be implementing. As I think about it a little bit more, I think this resource could be great for you know, a wellness coordinator, or at a work site, or you know, maybe if a clinic manager has a little bit of time in the clinic side. Really, you know, as we know, those people working as community health workers are trusted. They understand kind of their population, the people that they are trying to reach, and trying to connect to those to the healthcare system. The most important part is that they're trusted, and we know that people look to them as a resource and for information regarding health. So again, there are a lot of people in the community that are working as a community health worker that may not be called a community health worker, or don't even know that that's what the work that they are doing, but that is what they are doing. So this guide really just kind of breaks it down section by section. We do need to add, before we finalize the toolkit, we do need to add a section on how to market, you know, where to hand out flyers, where to let people know that this is going to be going on, and then kind of how to choose that location. So again, basically the community health worker would invite people to participate in this kind of social support project, where they would walk for 15 to 20 minutes at a time, talking about these various health topics. It's very similar to the Walk with the Doc program. In our experience, community health workers are just a little bit more accessible and have maybe, since this is something that they are passionate about, they have a little bit more time to dedicate to something like this rather than the healthcare provider, is what we found. So they would go through their 15 to 20 minute walk discussing the topic for the day. We found in our sort of lessons learned in implementing this last year that it works better if you keep the same location every time. It sort of is that comfort piece that comes along with social support in the first place, knowing where to go, knowing when to be there, knowing what's ahead of you in your walk. You know, where you're going is kind of that comfort piece when you are going to be taking information about your health. So just a lesson learned there. We tried different locations. It didn't work as well for us as it has worked when you have the same location each time you meet. If you scroll down a little bit, Brian, I think the first section that's on healthy eating would just then give the community health worker information on what to review, on evidence-based information regarding nutrition and healthy eating. And then below that, they could go down and pick some resources that they would want to give as handouts that they could use. If you see the first two handouts there, the Choose Healthy Here, you know, those are some materials that have been created by DHHS and Nebraska Extension, UNL Extension, that focuses on sort of that Nebraska branding for choosing healthy foods. So again, they could just kind of get a snapshot of each of those resources. Think about if that's something they would want to use for their group, and then click the link to go ahead and print those off pretty easily. So that's kind of the standard format for each of the topics. And that should take you through those 6. That would be, you know, a 6-week. You could run it 6 weeks if that's how you wanted to do it, once a week. And that sort of format is, I guess, a little bit more up to whoever is implementing and what works best for you. But there's just a ton of resources that are all evidence-based that the community health worker or whomever is implementing would be able to provide to the participants walking alongside. And we really would want to encourage them to not just give handouts, but really to be discussing this as a group. Again, that's that piece of social support where you build that little sense of community that brings you back each time. So I think an additional piece that, as I'm even going through this, that would be beneficial is to talk about then the community health worker at the end of this. You know, this is our first 6 weeks, but you've kind of created this group, you've created this community among your participants, then to encourage them to continue walking and to sort of build that that group out from there as sort of a starting point rather than an ending point. So that is that. Jeremy, do you want me to take questions now, or are we waiting for the panel to talk more about questions?
Yep. So Jen, I wasn't sure if you were going to cover something else or not. So I wanted to give you an opportunity in case you were. So Jessica, let's come over to you. Talk with us a little bit about some of the work that you've been doing in worksite wellness, and specifically the Walk It Guide, I think is what we loosely call that. And then what we'll do is I might have a couple questions for you guys as panelists, and then we'll open it up to the group.
You bet. Is there screen sharing, Jeremy?
Yeah, so you can either share your screen or you can have Brian share it. Do you want to just share yours?
Sure. I have the resources up.
Okay, so if you click down on the little share button down at the bottom, kind of toward the right, I think a little bit, it says screen share.
Yep.
And then you should be able to choose the resource that you want.
Okay. Thank you. Okay, can everybody see the walkability, campus walkability page okay?
I can see it.
Can somebody? Yeah, perfect. You're good, Jessica.
Hey, if you haven't had a chance to stretch or stand up, please do so. It's not fair to drone on to you about walking and the importance of it if you're sitting the whole time. So I hope you're taking the opportunity as we're going through these. I think what an exciting time we have for the signage guides and all the things that Brian showed, and the walk with a community health worker. Those are just really wonderful tools. And even being on the development of some of the signage guides, I still was taking notes and things that will be beneficial to our community. So just a little bit about my background and what I've done with this. So I coordinate the Worksite Wellness Council for the area. So we work with about 50 different member companies on their worksite initiatives. And so campus walkability is one thing that is very plug and play for businesses. They, especially if they're new, I've seen it as a really great, if they're new to the worksite wellness space, just a fun unifying project for wellness committees. So that's what I've kind of used it as for some, and that's been, if you're ever working in that space, I'm happy to give you some more feedback on that. But I wanted to share these websites with you because they are on our Panhandle Worksite Wellness Council page. So the campus walkability is really just a compilation of not all of them, but we have a handful of them. We'll be putting more up as we go along, but work sites that we've worked with and just some examples from them. So as Brian said, we've worked with the Chadron State College and the WNCC, the Western Nebraska Community College out here, but then a number of hospitals, a number of different organizations, and really looking at it from many aspects, but obviously that policy system and environmental support angle, and then some promotion with that. So we have just some basic demographic details on the businesses so you can see size and what they do, and then some of the examples with that. If you're one resource that we haven't fully it's out there, but we haven't fully promoted it. We've done some promotion with our internal membership with it, but I really see this as a fine tuning. And it's honestly just because I'm a perfectionist and I just want everything to be perfect with it is why I say that. But this is really the steps if you're working on a walking worksite guide. And Brian had allowed us to do this in a recent work plan, really with that rural angle. Because so many times we hear businesses, that they want to talk about active transportation or things. And we have some communities that, that can be in the conversation and that can be in the planning. But I'm going to be honest with you, some of our businesses absolutely laugh at us if we say that, just because we're so rural. And so we really kept that in mind in just all of the opportunities that we've had to work with businesses in what it really takes. And you'll see the process is very similar to any worksite wellness evidence-based process model of leadership support, using a committee, ideally your wellness committee, assessing, communicating, implementing, communication strategies, and then evaluation. So really, if you're looking at anything worksite wellness related, that's what you're going to go with. But then I just got very detailed in the questions. And so this download the full checklist. There's actually, like I said, a checklist with these questions on there. So if you're working with a wellness committee or interested in that, you can take a peek at that and download it. We wanted to keep everything super simple. We know that businesses are so darn busy, and make it very, very plug and play. And that's what we try to do with all of our businesses, is keep everything really, really simple for them. Because it's very easy for me to get caught up in my public health lingo, and they are like, okay, let's go back a step. So that's why we wanted to keep it at that level. So leadership support, looking at it from, are they supportive of wellness generally, but are they supportive of a walkable campus initiative? And then mid-level managers, just because they can really make or break whether that happens or not. If there is a 15-minute break, are they able to use it to be active? Is that supported in that language? And we do have some of the questions in there. And then just that it's undertaken by some sort of diverse committee with input from all of those angles. It's not just one person that's trying to do this for many reasons, not because we don't want to overwhelm that person because they've already got so many other things they're trying to do. But also on the other side of that is, if they're not pushing it down to their employees, we want it to be for employees and by employees. So that's what, with anything good wellness, we want to happen. And the assessment phases, some of them are break time specific, and then some of them are very environment specific. So if they go out, what does it look like? Identifying paths both inside and outside, and that's been a good angle for some of our businesses like the hospitals and the college campuses, just for that aspect that they have that ability with our lovely Nebraska inclement weather. But you can take a peek through this, and then it just has other things as well in there. So that's one resource. And then we also do a big promotion at the end of April annually for National Walk at Lunch Day, and we align with the national date on that. But that is honestly just something that we do as a promotion, as a something very easy but businesses can do. So if that's ever of interest, it's something you're interested in doing for businesses in your area, I can send you the toolkit on that as well. It has graphics, and everything that we do aligns with that Just Step and Repeat brand that Brian had said, because we want to keep everything branded in that same way. Because what we see cool happening is that we're branding it from a worksite angle, but in some of our communities now we have that larger conversation happening for a Walkable Communities Initiative. And so I say, well, this is cool that you're talking about it at the worksite level, but think about now, let's take it to that bigger conversation for community level too. So it feeds both ways. And especially from, I love that we have that, it's a great, the Just Step and Repeat's a great marketing angle as well. So I went through those quickly, but if you go to our website, pphd.org/pwwc.html, and I can have Brian or Jeremy send that out to you guys. Everything's on there. I'm happy to help with any of this. This is walkable campuses, walkable businesses, promotion for walking is probably one of the biggest things I'm most passionate about for work sites. And I've seen some really, really great successes with it. So happy to share anything on that.
Awesome. Well, thanks again to Jessica and Brian and Jen for sharing your valuable perspective with us. I want to give an opportunity for people to ask questions and for us to get a dialogue going. Keep in mind, after the Q&A, I'm going to talk a little bit about the mini grant opportunities that are available, so please stick around for that. But let's take questions. So we do have some participants on the line with us, and I'm going to give you an opportunity to ask your questions that you might have. So if you have a question, just unmute your line and let us know you have a question, and we'll go ahead and get you right in here to ask. So anyone have a question?
Hey, Jessica, this is Michelle from Buffalo County Community Partners. This is the first time I've actually seen your work site plan, and I was just wondering, how did you get it out to businesses? How did you distribute that either link, or did you give it to them in a paper form?
We gave it in several ways, and then we're giving it more intentionally as well. So we started with our advisory committee, because we have a smaller group that helps kind of guide our work. So we started with them and got their feedback, and then we have a monthly wellness chat with all of our businesses, and so I shared it on there, so then we can continue to refine it and say, hey, is this good? Is this going to be helpful? What else can we do? What else are we not considering? And then just overall promo. We do have a conference coming up in September that we're planning. We have a very, we're calling it Snap Session, where we're sharing about 15 minutes of resources, and we're going to share it there too. I see this as something that on twofold, we'll continue to refine to meet businesses' needs because we have it electronically, but also that we'll keep promoting it as much as we can, because we have so much momentum happening with it.
Yeah. Gotcha. And is that
the other thing we did is with National Walk at Lunch Day. So that can be any business in our area. It's not just a member company, but our messaging after that was, okay, great, you took a walk at lunch. Now let's talk about the bigger conversation of building this into an environment that you can have every day for your businesses. And so we shared those resources there too.
Yeah, gotcha. Cool. Thank you.
Mm-hmm.
Awesome. Thanks so much for the question. Other questions? Don't hesitate. Unmute your line. Ask Jessica, Jen, Brian, any question you have. Have kind of a quiet group today. All right. Going last time. Clark, Laura, Brooke, Jen, I'm sorry, Michelle, if you guys have more questions. If any of the panelists have questions of each other, you can always ask questions as well. While you're thinking of a question, I would say my question, so Jen, the resource that you put together and the resource that Jessica, you guys have been working on with the Walk It Guide, what are the things that you think really make those resources valuable to employers or the people that you're working with, right? So from your perspective, Jessica, what's the one thing about that guide that kind of makes it really easily accessible and easy for people to use? And I know you talked a little bit about language, but is that the piece, or is there something more to that? And same with you, Jessica, as you think, or Jen, I'm sorry, as you think about the guide that you guys were talking about, what is it that makes it really usable for people in your community?
I think part of it is that we've kept it electronic for that reason, that people can very easily access it. But two, we've also given very tangible examples of businesses that are of all sizes. Because we are so rural, we have businesses, and we have businesses that we engage with that are doing incredible work, and they're tiny. They are tiny organizations. I think people have this perception that when they implement something big like this, you know, this is the BNSF Railroad, and this is these large healthcare systems. These are organizations that might have 8 people in some of them. And so just saying, hey, this can be really harnessed by any size of company and promoted in that same fashion. So that's just one thing I think that's maybe been beneficial in our messaging.
Okay. Jen? Sure. I think for us, you know, like Jessica talked, or I think it was Brian that talked about the length of the toolkits, and ours does look a little bit long just because of the number of resources and the way we have the resources laid out. But that also, I think, is a sort of a benefit to it, that we kept it very light on what to do, how to do it, so that it can be really easily adaptable for each, you know, individual's situation and circumstances. And so I think, you know, keeping the wordiness down, that it's adaptable, and that really that they can see right from the get-go that it's going to help them achieve the goal that they have. You know, I just think it has got to be easy. It's got to be something that they can take, change little bits about it for what they need, not too specific, but enough that they can take it and use it right with what they have. So.
Mm-hmm. Brian, what do you, and again, I'm going to be coming back to the audience for questions. So I'm going to ask, you know, let's be thinking of some questions. Come on, let's make good use of everybody's time today. But Brian, as you think about these guides and really this, what I would call resource library, or library of resources that you know, DHHS and partners like Jessica and Jen and others have helped to develop, what do you really see as the ultimate impact if we were to really get this widely used by other health departments and things like that? Like, how could this transform what is happening in Nebraska and with respect to walking and biking and overall health? And I'm totally putting you on the spot for a little visionary.
That's a big opportunity. That's a softball. I appreciate that. What's fascinating is in the state of Nebraska, we are challenged by only 50% of Nebraska adults are being physically active. But that doesn't necessarily mean they're meeting the physical activity guidelines for Americans, which is about 150 minutes a week. And walking is one of the simplest forms of physical activity. So from the big picture standpoint, if we're able to implement social support programs, walkable campus initiatives, signage projects to get people out and active, it's going to be fantastic. We're going to see the numbers go through the roof of people being active, reductions in healthcare costs if you're looking at it from a worksite wellness approach. You're looking at increased productivity, reduced incidents of being sick from work, just coming from the worksite side. But think about what excites me most is thinking about the opportunities of how we can transform our communities about creating something that's more walkable, bikeable, that impacts the overall health of an entire community. So looking at the bigger picture of when people come together to make change and make it for the best and taking care of their neighbor, which, we do really well here in Nebraska. It's creating that social network of opportunity to impact your fellow Nebraskan. And so I think just the walking initiatives enough, the work that Jen's doing, the work that Jessica's doing, others are doing across the state, I think it's transformative. Some of the policy and environmental change things do take time, but simple steps of community health worker engagement and looking at the opportunities of having a walking club or doing signage projects or actually looking at the entire walkable campus opportunity. When I think campus, I think university and I think colleges, but that's just not necessarily true. As Jessica mentioned, there are other businesses looking at their entire campus and saying, well, how can we walk outside when the weather's nice? Well, how can we walk indoors when the weather's inclement? So I think that these two guides, one, provide us great opportunities of expansion of just getting people moving. And I know that's a troubling thing in this day and age, but it's also an interesting messaging piece too, because it allows us to say, you don't need a gym. And that's the mindset of messaging these days and seeing the media that you need to go to a gym to be healthy and active. I'm telling you, if you have a safe, accessible place, either at work or in your community or an awesome destination to walk to, like a park where I take my kids, you can be healthy and active. And a simple walk is a great opportunity to lead you on that path.
Awesome. Let's go back to the audience for questions. Anybody have any questions for our panelists today?
Jessica, this is Ashley. Here at Community Partners, we have a worksite wellness coalition that really focuses on wellness in the worksite, and we offer a very small, minimal worksite wellness membership. And really the hardest barrier we run into is buy-in. So what can we do to get that buy-in to, show the value of walking in the workplace, providing toolkits, providing wellness perks and things like that?
Great question, Ashley. When you say buy-in, are you saying just generally for membership or generally for a walking project?
I would say both. Our wellness package, I guess, is an annual fee of $300, and we provide like different perks and discounts, and we tie in with the annual walk at lunch, the walk out on your job. We do that every year, and this year we provided like a annual or a walkout walkability toolkit. And so just wondering what you found successful with enticing new businesses to come in and join on that wellness membership.
I think one thing too with due structure for consideration is just the vast amount of very small businesses that we have. And we started our council in 2011, and it was interesting because we were just having the dues conversation only because another entity in Nebraska was, and they're partnering with us on something. Anyways, I said, we're trying to make it more accessible. And we actually created another even smaller business layer of dues, just because we don't ever want that to be the barrier for businesses, because we have so many public health resources we're bringing into that. So that's just one sort of strategy thing. The other thing is using and I forget this sometimes just because we're going along and doing so much of our contracts and work, but using that advisory committee so much for messaging, because I can say it till I'm blue in the face about how great this is and how wonderful this is, but if they see, you know, X person from Chadron Community Hospital doing it, that makes all the difference. And so anytime I do a news release or anything, I try to just give that angle all the time for messaging. And then also, like for instance, we just did a big promotion for a web-based challenge that we had. And when the media is there, then I say, and they did a walkable campus initiative, let's walk over, I'll show you the outside pictures of what they're doing. So just to give those very tangible examples of what it is we're talking about, because sometimes businesses think it's some exhaustive program that you have to do, you know, and there's all these things that you're going to have to do. And I say that, you know, if you want to go to that level, we can help you take you to that level. But part of it is just starting with something simple like a walkable campus initiative. And that has been a fun team building, like I said, as well, just for unifying committees as they begin down that path too.
Good question. Any other questions?
I actually have one for Jen. I think the Walk with a Community Health Worker, that resource that you guys compiled, Jen, is fantastic. How wonderful. I would love to know where we can access it. And then also, I think there could be some linkages with, if you haven't presented to the National Diabetes Prevention Group for work sites that has been meeting, I think that would be a great resource for them.
Awesome.
So Jessica, I'll just clarify, we're going to send out all the guides as part of the follow-up to this call and get them posted in a blog and on the website as well. So you'll be able to get that resource directly.
And since ours isn't like totally completed yet, but I did want to get it on here so that people would know that it's coming. We will have that. That's something we will put on our website. So our Public Health Solutions, PHS site. So we'll get that up here. Probably my goal is to have it up next month. So that will be there. And I can send the link out and I can send it to Jeremy, maybe to send out as a follow-up to this. I also just wanted to touch on that, the question about, you know, kind of engaging businesses that are doing walkability already or want to do some sort of walking project. Some of the projects that we've had with some work sites in our area, the biggest thing has been that we've seen has really been that leadership support. So when we've identified kind of that champion that wants to work on it in their organization, you know, whether we've done mapping routes or different signage, they've kind of taken what's worked really well for at least one of our businesses is to take that signage then and to use that to actually create some sort of, you know, internal challenge so that it's not just like, hey, go use this. You know, they're also promoting it during their breaks, but then also just having sort of a separate challenge that really gets people using those in different ways. So that was just one little thing I had that I wanted to throw out there. So
great questions. Thank you, community partners, for two really good questions. So Clark, Dennis, Brooke, we haven't heard anything from you guys. Any questions from you? Or anybody else that I may have missed? Okay. So before we start talking about the mini grant opportunities that are available, I want to actually take a second and ask each of you to just kind of reflect on the resources that we've shared today, and to really think about how you might actually be able to tap into those and use those in your work. And so I am going to actually, this is one of those where if you're not really paying attention, you really want to start paying attention right now, because each of you is going to be asked to weigh in with what is one thing that you're taking away from today's conversation, whether it's a guide or a resource or just part of the conversation itself that you think will be able to impact your work tomorrow or in the near future. And I do want each of you to weigh in, because I think it's really important to kind of reflect back, you know, and let us see. And I'll ask our panelists maybe to even weigh in as well. So I'm not going to put three of you on the spot up front. Instead, I'm going to actually, just because they asked so many great questions, I'm going to actually pop over and ask Michelle or Ashley if maybe you guys might want to start off this reflection by just talking about one of the things you might take away from the conversation or the resources today.
Yeah, thanks, Jeremy. Well, one thing that stuck out, we are working on work sites, like Ashley and I have said. So Jessica's information is going to be so helpful. I'm sure there's things that we can use of hers. And I'm also just kind of thankful to be connected with her. If we ever have questions, I'm sure, Jessica, you'd be willing to let us follow up with you. But then also Jen's, the community health worker walking program. We have some walk with the doc programs going on here in Kearney. So I think that would be great information to kind of send over to those partners. So that's, again, not a program we specifically run here, but our partners do help support that. So that's a great resource, Jen. I'm really excited to look into that.
Awesome. And I'm going to come back and ask in just a minute if Ashley has any others, but I'm going to go over to Laura next, and then I'm going to go to Jen Hansen. So Laura?
Yes, hi. So I've been sitting here. I really am interested to just get my highlighter out and look at all these guides and see. I have maybe some questions about how do you incorporate people of different, who are capable of different types of activity levels in these programs or in these walking programs, but that might be a question I would have, but it might be in the guides. So since I haven't had a chance to look at them, but thinking we have a worksite wellness programming here as well, and we've had some really good success with some Steps to Wellness program we did. We just got a NACCHO Promising Practice Model Practice Award. So for that, so I want to see kind of like where we're sitting compared to these guides and how we might tweak our worksite wellness to improve even more.
That's awesome, Lauren. I'm really glad to have you on our call. I want to tell you all, Laura just launched the Henderson community, which is our 14th community on the project. We did their design team meeting yesterday down in Henderson. So it was really great to see that happen and to see that progress that Laura's making there. And it looks like she had to leave. So we're going to go, I think I said I was coming to Jen next. And so we're going to go Jen, and then I'm going to go to Clark. So Jen.
I also really appreciated the information that Jessica gave because just really, I love the way she just laid out the questions. And I think even for us who, we've done this work a few times in a few different organizations and different types of organizations, but I think that will actually, having that information will help us just to be a little bit more solid as we go into future work and future organizations. So yeah, that's what I'm excited about.
Awesome. Thanks, Jen. We're going to go over, instead of going to Clark, who it looks like has left, we're going to go to Brooke, and then Dennis, you are on deck. So, Brooke, what is one thing you're taking away from today?
I think just I thank you, Jessica, for sharing again how you engage with work sites and really do this walkability stuff. I think you have great success there out in the Panhandle in that rural environment. And so just sharing that success and some of your tips are always helpful to bring back to our communities.
Awesome. Thanks so much. All right, I'm going to go over to Dennis next, and then to Jessica. Oh, you know what? That's interesting. It looks like I will not be going to Dennis. it's not showing that his audio is connected anymore. So we'll move right along. So I'm going to go Jessica, and then I'm going to go to Ashley and check in to make sure you don't have anything else, and then Brian will give you final comments.
Okay, I liked all the signage guides that Brian had shared with the different sectors. That is really helpful, and it does, I mean, each one does have its own unique needs, and so it is helpful to lay it out that way. I liked in the toolkit that Jen had shared the printouts, and that they aligned with the Choose Healthy Here messaging. Thought that was cool, and that they would literally just be super simple to print out for, you know, if you're out, like I could share it with our community health worker and she could use those. I think that's why I was so excited. I think they need to share that with the National Diabetes Group that's been meeting for work sites, because I think I could see where they could feature it. We have a monthly call, or I don't, but our DPP facilitator does, and that could be a resource that they highlight to share with the different lifestyle coaches, because I could see a lot of value with that. I think those are the main things. I just appreciate all the questions on here. That's really good dialogue.
Awesome, thank you. Looks like someone just joined us with the last 4 digits of 2130. Anybody going to claim that? Okay, well, unfortunately, oh, we can hear you, Dennis. So I do have Dennis with me. How you doing, Dennis?
Yeah, I thought I was hitting the speaker and I hit the disconnect. So I don't have a microphone on my computer, so I have to do it on the phone.
That's all right, Dennis. What's one thing that you're taking away from today's conversation that you think might be helpful to you guys?
Well, I think there's some written documents and guidelines that I can pass along to people who are getting interested in taking this project and to the streets, literally.
Mm-hmm. Okay. I'm going to go back to Ashley, check in with Ashley, and then I'm coming to you, Brian, and then I'm going to actually talk about the mini grant. Ashley, did you have anything else you wanted to add? I know Michelle already weighed in.
Yeah, I think I'm excited to hear about the worksite successes that are going on across the state, and then also just the potential that Kearney has. There's a lot of great trail systems already in place, and that they just keep expanding, and the signage really could help with that piece. And then, like Michelle said, we have the walk with the doc, and just being able to increase awareness of those and engage those new residents that aren't walking already. A lot of that, those top populations are already set in their ways and those habits. It's just normal for them to live that healthy lifestyle and walk. So just engaging those new partners and the social support will help with that. So I'm excited for that.
Awesome. All right, Brian.
So what really excites me is these guides were created not from a top-down approach, but from a bottom-up approach. It really was developed locally based on experience and work that's happened. And then what that does is those guides themselves are step-by-step approaches that are allowed to be innovatively implemented at the local level. So these guides are not state-based guides. These guides are for local communities to come together, decide how to move forward, and put your local touch on it. Because what Jessica does in her area could be different than Jen's, than in Omaha's, than in the Northeast. And so that's what I'm really excited about, is that these guides allow for innovation and modification to really fit the needs of the local community, the target populations that they're reaching, the types of businesses they're reaching. And that to me is extremely exciting, because it's not a one-size-fits-all type of approach. So these guides can really be resourceful to you at the local level for you to take it however you want to take it and move forward with moving towards getting people healthy and active.
Awesome. All right. Well, thanks everybody for weighing in. I am just getting ready to, oops, you should be able to see my screen, and you'll see a document at the top. that says Nebraska Walkable Communities Initiative mini grant application. Does everybody see that?
Yes.
Yes.
Yep.
All right, awesome. Oops. All right, so we have a limited number of grants that are available to help you between now and the end of September in implementing some guide-related work. So it can be anything that relates to the signage guide, the social support guide, the walk it guide, the walk with the community health worker guide. And we wanted to make this application process as easy as possible. I know all of you spend a lot of your time writing huge grant applications, and I didn't want to overtax you like that. So we do have grants that range, mini grants that range from $500 to $1,000. We're doing our best to try to figure out how to take the limited amount of funding that we have and be able to tool that in a way that's going to work best to have the most impact. And so what we're asking is that each applicant complete this application. If you look down at the bottom, there's instructions. So answer the questions above in a Word document and send it to Jeremy Grandstaff, jwg@sgendeavors.com. We're actually just coordinating the grant pieces. The decision will be made by Brian Coyle and DHHS. And again, we're not trying to over-process this too much. We want to get some money in your hands to help you start using these guides, to start looking at your approach to that. Questions that we're asking you to answer as part of the application process include, of course, your contact information. What's the overall purpose you're trying to achieve with your work, and how will this additional funding help you achieve that purpose? What specific activities will you do as part of the work that you're proposing? Who are key stakeholders and partners that you'll work with? How much are you requesting? And how will the grant funding be spent? Please do not say we're going to spend, we want $1,000, we're going to spend $1,000 and not give me detail. You gotta give a little bit of detail so that we have a general understanding of what you're trying to do and what you're trying to accomplish. You'll notice that question 4 asked about partners or key stakeholders to help you with these activities. This is a good opportunity for you to be collaborating with partners. What you don't want to happen is to have 2 people in your community be submitting an application for a mini grant that are not even talking to each other. And we're going to be looking for applications that really are, especially when we're talking about signage or social support, especially really looking to build those relationships and use this as an opportunity to build relationships within your own community. That's the general overview. It's very simple. You have until July 5th. Essentially, I will send out, there will be a blog post that goes out a little bit later this week. You guys will get in advance. It'll go out officially probably on Friday, like on social media, and we'll blast it out to a bunch of different people across Nebraska. But because you guys attended the call, we want to give you first opportunity to respond to those grant opportunities, many grant opportunities, sorry. And I think that's basically it. So let me just check in with you, Brian. Is there anything I should have covered?
I just want to piggyback on your comments and just mention that this doesn't have to be a new project. So if your community is already working on a signage project or a wayfinding initiative or doing some sort of walk with the dock programming, you can still apply for this to help supplement that work. But we also want to know about that as well. So part of this money is available, thinking about it from the signage aspect, that local communities may not have enough to fully implement the signage efforts they want. challenge for this is it has to be used by September 30th. So if you're able to latch on to a specific project that's already happening, that you know is going to move forward, and you're able to purchase more signs, or you're able to connect with the social support campaigns because of Walk with the Doc to support those opportunities, that's fantastic. One of the caveats I will tell you is that food cannot be supported with this or infrastructure development. You can't purchase cement for trails and stuff like that. So that's one piece that we forgot to mention actually in this mini grant application.
And you know what, Brian? I'm really glad that you said that we should at least have a list of things we cannot cover in the grant. So I'll make sure that we get that before I release this on Thursday. My apologies, folks. We wanted to keep it so simple that we may have made it too simple. So, so what questions are you having? Any questions from any of the participants? All right. Well, in that case, I'm looking forward to seeing some outstanding mini grant applications coming in on July 4th. My ask to each of you, though it may not seem that it's to your benefit to do so, please share this with your networks. My recommendation to people who are working in larger communities or even communities that you are trying to build those relationships is use this as an opportunity to form a relationship with another organization that's going to take your work to the next level. So if you're trying to reach into the Latino community, reach into the Latino community by working with an organization who represents the Latino community. My friend Adolfo Hernandez used to say, if you want to get access to the people, then you go to where they are and stop expecting them to come to you. And these social support guides and other guides that we've put together and highlighted today, they really give you the opportunity to do that in a really unique way. So I want to once again thank Brian and Jen and Jessica. Honestly, these three are just really outstanding leaders to work with. You guys are changing the landscape of health in Nebraska through the work that you do on a daily basis. And so I really appreciate the opportunity to work with you. And thank you all so much for sharing. To our participants today, this is an opportunity. We want to hear how you're using these guides. So if you've got feedback on how you're using the guide and one of the guides, do email us, let us know. You can always post it on Facebook and tag it with WalkNE or hashtag BikeNE, and we'll pick that up as well. And once again, just a reminder to apply by July 5th for the mini grant opportunities. We're going to turn those around pretty quickly because I know you've got a limited time to work in. We are only talking $500 to $1,000, and so I don't think that that's going to present a challenge to any of you as far as figuring out how to best use that. So if you do have questions, you're welcome to stick around. I'll take other questions at the end of the call, or I'm happy to stick on. But does anybody else have anything before we end today's call? Okay, in that case, this concludes the webinar for today. I really appreciate everybody coming, and please distribute widely to your network. Thank you.
Thanks, Jeremy. Take care, everyone.
Thanks, everybody.
Thank you. Thanks, Jeremy.
Thank you.